Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Musculoskeletal System, Part B, Disease and Conditions. Question number 1. A condition characterized by a disease in bone density and mass, often leading to porous and fragile bones, is called A. Osteomyelitis, B. Osteopenia, C. Osteoporosis, D. Osteoarthritis. Think the answer. The correct answer is C. Osteoporosis. Osteoporosis. Osteo mean bone, porosis mean porous. It's a condition where bones become brittle and fragile from loss of tissue. Osteopenia is a less severe bone loss than osteoporosis. Question number 2. Gout is a form of arthritis caused by A. Autoimmune destruction of joints, B. Chronic infection of bone tissue, C. Buildup of uric acid crystals in the joints, D. Degeneration of joint cartilage. Think the answer. The correct answer is C. Buildup of uric acid crystals in the joints. Gout is a painful form of arthritis resulting from the accumulation of uric acid crystals in a joint, commonly the big toe. Question number 3. The medical term for the painful inflammation of the fluid-filled sac located near a joint is A. Tendinitis, B. Bursitis, C. Synovitis, D. Fasciitis. Think the answer. The correct answer is B. Bursitis. You can see near the joints you will have the bursa. This bursitis means bursitis inflammation is the inflammation of a bursa, which is a small fluid-filled sac that reduces friction between tissues. You can see these are the fluid-filled sac called bursa. The inflammation of bursa is called bursitis. Question number 4. An injury to a ligament caused by a sudden wrenching or tearing is termed A. Sprain, B. Strain, D. Subluxation, D. Tendinitis. Think the answer. The correct answer is A. Sprain. Sprain is an injury to a ligament which connects bone to bone. Strain is an injury to muscle or tendon. Question number 5. What is the medical term for the lateral, that is sideways curvature of the spine? A. Lordosis, B. Kyphosis, C. Spondylitis, D. Scoliosis. Think the answer. The correct answer is D. Scoliosis. Scoliosis is the abnormal lateral curvature of the spine. You can see this is the scoliosis and the kyphosis here. Kyphosis is an abnormal posterior curvature that is called humpback, and the lordosis, you can see here, lordosis is an abnormal anterior curvature that is called swayback. Question number 6. The inflammation of the synovial membrane lining a joint is called A. Osteomyelitis, B. Myositis, C. Synovitis, D. Osteitis. Think the answer. The correct answer is C. Synovitis. Synovitis, their synovium is called the synovial membrane. Itis means inflammation. So the synovitis is the inflammation of the synovial membrane. Question number 7. Chondromalacia is a condition of the abnormal softening of what specific tissue? A. Bone, B. Cartilage, C. Tendon, D. Muscle. Think the answer. The correct answer is B. Cartilage. Chondro is the combining form for cartilage and malacia means softening. So, the most common form of chondromalacia is patella, that is a runner's knee. Question number 8. A PCC notes the patient has tendinitis. This is the inflammation of the A. Bone, B. Ligament, C. Tendon, D. Joint capsule. Think the answer. The correct answer is tendon. The name itself indicates tendinitis. That means inflammation of the tendon. Question number 9. The rupture or tearing of a muscle is medically termed A. Myalgia, B. Myositis, C. Myorexis, D. Myoma. Think the answer. The correct answer is C. Myorexis. In myorexis, myo mean muscle, rexis mean rupture. So it's the rupture or tearing of a muscle. Myalgia is muscle pain and myositis is muscle inflammation. Question number 10. Inflammation of the bone and bone marrow, often caused by bacterial infection, is called A. Arthritis, B. Osteochondritis, C. Osteomyelitis, D. Spondylitis. Think the answer. The correct answer is C. Osteomyelitis. Osteomyelitis, osteo mean bone, myel mean marrow, itis mean inflammation. So, it's the inflammation of the bone or the bone marrow. Question number 11. A fracture that occurs spontaneously as a result of disease or weakness, not due to trauma, is called A. Stress fracture, B. Simple fracture, D. C. Pathologic fracture, D. Comminuted fracture. Think the answer. The correct answer is C. Pathologic fracture. Pathologic fracture is caused by a weakened bone structure such as from osteoporosis or cancer rather than a significant injury. Question number 12. The inflammation of the bone and joint that is typically painful and caused by degeneration of the joint cartilage is A. Rheumatoid arthritis, B. Ankylosing spondylitis, C. Osteomyelitis, D. Osteoarthritis. Think the answer. The correct answer is D. Osteoarthritis. Osteoarthritis is a degenerate joint disease where osteo means bone, arthro means joint, itis means inflammation caused by a wear and tear of cartilage. Question number 13. The medical term for soreness or pain in the muscle is A. Myopathy, B. Myositis, C. Myalgia, D. Myorexis. Think the answer. The correct answer is C. Myalgia. In myalgia, myo means muscle, algia means pain. So it's a medical term for muscle pain or soreness. Question number 14. A condition involving the abnormal reduction in the size of muscle tissue due to disuse or neurological damage is called A. Hypertrophy, B. Myasthenia, C. Atrophy, D. Contracture. Think the answer. The correct answer is C. Atrophy. Atrophy is the wasting away or reduction in the size of an organ or tissue, particularly muscle, due to non-use or disease. On the other hand, hypertrophy is an increase in size. Question number 15. Ankylosing spondylitis is an inflammatory disease that primarily affects the A. Shoulder joint, B. Spinal joints leading to fusion, C. Knee cartilage, D. Hip bursa. Think the answer. The correct answer is B. Spinal joints leading to fusion. Ankylosing spondylitis is a form of chronic progressive arthritis characterized by inflammation of the joints and ligaments of the spine, often causing vertebrae to fuse, that is ankylosis. Question number 16. A malignant tumor composed of bone tissue is A. Osteitis, B. Osteoma, C. Osteosarcoma, D. Osteomyelitis. Think the answer. The correct answer is C. Osteosarcoma. In osteosarcoma, osteo means bone, sarco means flesh or connective tissue, oma means tumor. So it's the most common primary malignant tumor of bone. Question number 17. The displacement of a bone from its normal position in a joint is A. Fracture, B. Dislocation, C. Sprain, D. Subluxation. Think the answer. The correct answer is B. Dislocation. You can see here, this is the normal joint, shoulder joint. Here you can see the dislocation, the humerus going down. So a dislocation is the complete displacement or separation of the joint surfaces. On the other hand, subluxation is a partial or incomplete dislocation. Question number 18. What is the full form of the medical abbreviation ORIF? ORIF. Think the answer. So ORIF means open reduction and internal fixation. ORIF stands for open reduction internal fixation, a surgical procedure used to repair and stabilize fractured bones. Open reduction refers to surgically exposing the fractured, realigned bone fragments. Internal fixation involves securing the bones with devices such as plates, screws, or rods to maintain alignment during healing. Question number 19. Myeloma is a malignancy that develops in A. Muscle tissue, B. Bone marrow, C. Cartilage, D. Ligaments. Think the answer. The correct answer is B. Bone marrow. For example, multiple myeloma is a cancer that forms in a type of white blood cells called plasma cell. These plasma cells are found primarily in the bone marrow. When they become malignant, they proliferate uncontrollably, producing abnormal proteins and crowding out healthy blood cells. Question number 20. Rheumatoid arthritis is best described as A. Autoimmune disease causing chronic joint inflammation, B. Bacterial infection in a bone marrow, C. Degeneration of cartilage due to aging, D. Viral infection of connective tissue. Think the answer. The correct answer is A. Autoimmune disease causing chronic joint inflammation. Rheumatoid arthritis is a chronic systemic autoimmune disease. In rheumatoid arthritis, the immune system mistakenly attacks the synovium, that lining of the membranes that surround the joints, leading to inflammation, pain, stiffness, and eventual joint damage and deformity. Question number 21. Myasthenia gravis is a condition characterized by A. Bone loss, B. Joint inflammation, C. Chronic muscle weakness due to nerve impairment, D. Cartilage degeneration. Think the answer. The correct answer is C. Chronic muscle weakness due to nerve impairment. Myasthenia gravis is a chronic neuromuscular disease that causes fluctuating muscle weakness. It's typical in autoimmune disorder where the immune system attacks and blocks or destroys the receptors for the neurotransmitter. The bonus quite a little bit tough one. Torticollis is a condition characterized by A. Fracture of the clavicle, B. Degeneration of knee joint. C. Wry neck involving a stiff and twisted neck. D. Inflammation of the heel bone. So think the answer, leave your answer in the comment section. Also see the pin comment for the real answer. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me or you can WhatsApp me. Thank you.